A number of couples struggle with getting pregnant. We say they have infertility. And as women pursue their careers and their educations farther and farther into their reproductive life, just advanced age tends to reduce their fertility. Infertility treatments have been around for a long time. In the early 1980s, we discovered how to do in vitro fertilization, or the test tube baby procedure. And it's been a real godsend for many couples around the world. Unfortunately, it's become the go-to for everyone who can't get pregnant and has taken on almost mystical significance, oftentimes to the detriment of the couple and their financial security. Many times couples forget that there are other treatments, far less costly, far less invasive, far less complicated, that can be equally effective if applied in the proper setting for that couple. I've been fortunate to have been around at the advent of the first IVF program in the United States and was trained to do IVF long time ago and have done it to one degree or another ever since. First cycle, 1982, back when dinosaurs roamed the earth in the IVF arena. What that perspective has given me, the chance to see what's happened to the business and practice of in vitro fertilization. IVF can sometimes become a non-thinking person's approach to every infertile couple. You don't have to really diagnose anything if you can bypass all of the normal functions and do IVF to treat it. Kind of like if your car doesn't start, you take the entire engine and drivetrain out and put in a brand new one. It's an expensive approach to fix maybe a loose wire or a new battery. But the answer is it works. The problem is there's a lot of time, effort, and money involved, and much of that can be avoided in many cases. A thinking person's fertility treatment should be focused on her and her husband and exactly what's going on with them. Personalized medicine with a personalized approach, not too much, but just enough to get to the result, which is a live-born child. My approach to the infertile couple is to take it one step at a time. First, to evaluate both him and her. Sometimes she may come for the consultation, but in fact, about 40% of the time, the blame, although we never use the word blame, is on the male side or male factor or has something to do with the sperm. So we need to have a good evaluation of the male partner also. But more importantly is a slow, progressive, and individual approach to what's going on in her and finally with them. You may not believe this, but I have conceived some or helped some couples conceive by telling her to change the lubricant that she was using, A, unnecessarily, and B, it turned out was contraceptive. This after many, many dollars were expended in another practice, only that there was no serious attempt to determine what was really wrong. I've had numerous couples who were trying to conceive at the exact wrong time of her cycle that only needed good counsel, a few suggestions, and I didn't need to do anything else. Now, everyone isn't that straightforward or simple, but a careful, individualized approach can often uncover little things that are the weakest link in the chain and preventing effective conception and childbirth. There are clearly couples that need more aggressive and complete approaches to their infertility care. And I've consulted with men and women and couples from all over the world who either need to come to the U.S. for other purposes or do not have access to the latest techniques and care that we can provide here. That's really an important phenomenon because it gives me, in our practice, a broader context for understanding women and men and couples from all walks of life, from countries all over the world, who need individualized care and may think they need the full court press when maybe they only need some counseling and minor degrees of oral medication. Don't get me wrong, in vitro fertilization, the test tube baby procedure, is the gold standard for couples that simpler, less expensive approaches won't work. In addition, having been around for this long, I know all the experts of all the different really minutia type problems. If we need to send someone or get some expertise outside the practice, that's always available. It's one of the benefits of having all this gray hair. For those couples that do need IVF, where nothing less expensive, easier to perform, and less invasive won't do, we do IVF and our results are as good as anyone's. That said, we frequently see women who don't need it and many who've already spent lots of time, effort, and money attempting to conceive using IVF, where simpler measures would have been just as effective, if not more so.